Well, a great pleasure right now to have joining us on the show today two guests, two authors of a book which I'm sure is going to help a lot of people. It's called The 7-Minute Back Pain Solution, 7 simple exercises to heal your back without drugs or surgery. In just a minute today, we're joined by Dr. Gerard Girasole. He's a board-certified orthopedic surgeon who works at the Spinal Fellowship at the Hospital for Joint Disease in New York City, and Kara Hartman, herself a back pain survivor, now helping others. And Doctor and Kara, thanks for being with us today. How are you?
Good. How are you?
Doing great.
I'm doing great as well. Good to have a chance to talk to you both. As someone who is maybe not a lifelong back pain sufferer, but I've had my bouts, I guess as most people have. No more helpful book you can write for many people right now. Thank you for writing it. I speak for everybody.
I speak for over 30 million people.
How prevalent is back pain, Doctor? I mean, other than just normal aches and pains that people go through. I mean, debilitating back pain. Is it 30 million people? Is that many?
It is very common. 8 out of 10 people will suffer from low back pain at some point in their lifetime. There are over 30 million Americans in pain from backaches at any given time. Nearly 1/4 of all American adults experience it at least one day of back pain every 3 months. It is the leading cause of consuming over $5 billion in healthcare costs, and also the leading cause of people being out of work in the workforce.
And Kara, I know you suffered from this as well, and I guess you've done many of the exercises that are in this book. Did you kind of work with the doctor to create these exercises for your particular plan, or how did you get involved?
Yes, yeah, I did. I was a back pain sufferer. I suffered for many years, which was extremely depressing and debilitating, and Dr. Girasole was my doctor, and I created this program, which is advice on the stretching and the core routine. I actually became a personal trainer years back, and we became very passionate about this book in terms of trying to help people and get the word out there and trying to dispel a lot of the myths that go along with back pain and the fear.
Yeah, you talk about a couple of the myths, Doctor, that you always hear different treatments, or you're going to need surgery, or you have a disc out of whack. Most of it, at least from what I gather from reading your book, can be, if not alleviated totally, can be helped by doing these stretching exercises, and you can avoid surgery, I guess, in many cases, right?
Well, to be quite clear, I mean, there's still a point of surgery that's needed for the back. That's why I have a job. And for certain syndromes that have nerve involvement or instability, those are things that really are surgical problems. But for the most common cause of back pain, which this book was set out to treat, most patients can be relieved of their symptoms and or prevent their symptoms. I mean, myths of back pain is, people feel the severity of their pain equals the severity of their problem, and it's really not true. Back pain is very painful, and people are astonished when they come in the office and you really make light of this pain, not in a bad way, but you're not concerned that this is, the old feared herniated disc or this is going to need surgery. Most of your back problems can be treated non-operatively.
Why is the back such a problem? I mean, it's a marvelous piece of machinery when you look at it, but it is very delicate at the same time. What are we doing wrong that we have so much back trouble?
Well, what we're doing wrong is, and this is a great segue, I mean, we term this phrase back mindfulness. People don't understand or aren't aware of how crucial your back is to every motion and movement you do in your general day, and we take it for granted. And if you don't work out core muscles, which are circle around your spine, think of your belt as being the core muscles, encompassing the abdominal, the pelvic, the hip, and the low back muscles, they really structure to get the signals from the spine to have you bend, flex, twist, whatever you're going to do, in not only sports, but in everyday just walking and everyday activities. If they're not worked, and that's where the key thing is. People do not understand what the core is and don't understand how to build it or strengthen it. That's where this book comes in. Everybody's so concerned about making the rock-hard six-pack abdomen. You need a six-pack back to go along with it, and they fail to work it out. So if you have a weak core, and the muscle, it's like anything else, and computer stuff, bad data in is bad data out.
Kara, had you suffered a particular injury, or did you just twist it one day, or what caused, if you don't mind me asking, what caused your back problem to begin with, or was it multiple things?
Funny, as you're asking this, I actually sneezed, and I was told that I sprained my lower back, and I immediately went into, I was tilted to one side, and I couldn't straighten up. And it was years of going, different doctors, different opinions, and it wasn't until I met Dr. Girasole who really explained what was going on with my back, and together, we came up with this plan to help other people who actually are probably in the same boat as I was in.
Talk a little bit.
Amazing. I really thought I had operated on Kara at one point, and that's the amazing thing. When I saw her back 5 years later, she did a great job in getting herself back in shape, and I was pretty impressed. And I also have back issues, and she's helped me.
It is amazing when you think of it. You mentioned sneeze, chip catch. I've had my situations where you twist just the wrong way. You're not even playing a sport or anything, and it can throw it out. And other times you can be really working vigorously hard, and you're okay. So I guess it's just a matter of maybe the back wasn't as warmed up or stretched as it could be at that point. Is that the basic premise of these exercises? Get them warmed up.
It is basic, but also how your localized motion segment, and we described it. My job in the book was to describe all the anatomy and try to describe the different causes of back pain. But if you keep it simple, think of like an Oreo cookie. The cream in the middle is your disc, and the cookies are the bone. If you have any kind of damage or even microtrauma or some kind of predestined that the discs are very gelatinous and they're water, if they start to dry up, then they make the back susceptible. And this is where you really need your core to kick in. And that's the basis of most common cause of back pain.
And also people not lifting with the legs. I always heard that. Lift with your legs, and that's the best way to do it.
I mean, a lot of people a lot of things we do in life is because we're busy. And a lot of times it's like, I can wait for somebody to help me, or I can just jerk this up and get it done, and then that twisting motion. When you picture somebody standing erect and bending 90 degrees at their waist and then lifting a heavy object, think about it. In your hand, that heavy object, all the force goes to your low back. That's bad, as opposed to what Kara's design, bending your knees, lifting it, and dissipating the weight, where it's not all on the back. As you said before, why is it just a bad anatomical function we have is the back? No, it's just that we improperly use it and we don't protect it. That's the difference.
Kara, what are some of your favorite exercises to do? There's so many in the book. Do you have to kind of put them into your own lifestyle or your own ability that you pick and choose, right, of those? Is that the best way to go about it?
Yeah, well, it's really everything. I mean, this book is you're going to be armed with knowledge when you read this book. And what we did was we took the fear of back pain. We're trying to make that panic disappear, to tell you what to do, why you're doing it, and also how to move precisely in the moment and for that particular situation. Because it's not just, as we talk about, strengthening and stretching, it is preventing. You have to prevent this from happening. You have to see your back for what it is, that you're using your back every time you move, and that you shouldn't wait for, wait till something happens. You have to really take care of your back. The protection actually, stops prevention. I mean, once you protect, you don't have to worry about going, running to the doctor. Not that you shouldn't if you do need it, but you can actually take care of yourself if you follow the book.
Well, it's a great, well laid out book. You give diagrams of the different exercises that you can do. I've done many myself, Doctor and Kara, and they have helped me in the past. And Doctor, give out a website. People can get a hold of both of you or get the book if they like.
Yeah, we have a website we designed. It's called 7minutebackpainsolution.com. On the website, you can read through the book. It's interactive. Look at testimonials. You can look at videos and also connect to other forms like my practice or whatever if you need other information. But it's a very informative webpage, and you can also purchase the book in any form or fashion nowadays. Nimble, Kimball, voice, everything. So it's all there.
Great. Dr. Gerard Girasole and Kara Hartman have been our guests. And Doctor and Kara, thanks for joining us, and good luck with the book, and hopefully we can talk to you again sometime.
Thank you very much for having us.